Hello, hello, hello. We are live, everyone. Everyone, we are live. Hello. Great, beautiful, blessed Tuesday, May 28th. May is Lupus Awareness Month. Throw your L's up, Lupies. My lighting is really interesting. It's very exciting today. That's awesome. So, day 24 of 1 Minute Lupus Lessons. And I am your host, Tennille Stewart. I help women who have been diagnosed with lupus go from confused and discouraged to healed, hopeful, and in control of the medical narrative. Hello, what up, Bayesian Shinobi, Jermaine? Hi, Macy, my friend, my loopy buddy. Today, man, I want to talk about something, happy Tuesday, something that I don't know that people really think about when they hear about somebody with lupus. So you know how like medicine costs money? You know about that? Yes, the financial part of having any autoimmune disease, any chronic illness is intense. The Google says, AI says, lupus can cause a significant financial burden with an average annual cost of up to $50,000 per person, depending on the severity of the disease. This cost can include direct and indirect expenses. To help reduce financial worries, people with lupus can try to be proactive about their medical expenses. This can include asking questions, doing research, and reviewing itemized healthcare bills. Ooh, that's for real though. Review those bills because since they know you're sick, there's a lot of mistakes that happen and they don't do much to check them. It's very weird. If you look at your itemized, and you're entitled to itemized bills. So if you don't get one, you ask for one. And then while you're waiting, you don't have to be paying while you're waiting. So ask for the itemized bills, and you can contest. Is that the word? You can, tell them, no, I'm not paying this much for this. And they have to review it. Like, it's legally what they're supposed to do. However, most people, if you are sick, you're not paying attention to that stuff because you are sick. So, like, generally, you're not thinking about that. Even, like, people having babies or, like, any medical procedure you have, ask for an itemized bill. You will find all kinds of mistakes on there. I'm going to look for, there's some, like, Instagram people and YouTube people that help you to be dissecting medical bills and, like, getting free things, which is so necessary, especially if you are in medical offices all the time, you have to see specialists, you're in the hospital on a regular basis. These are things you need to know. Otherwise, they will break you. And they have no kind of, you're a number. You're not like maybe they'll know your name, or like people who've known me for years in the medical field that never got to know me except for they call me Mrs. Stewart. Okay, Mrs. Stewart, da-da-da. The people who are my homies, that are medical people who I've seen for years, they call me Tennille. Or, like, if you're calling my full government name, you don't know me. You're not friends. Like, you're just my nurse, my doctor, whatever. It's fine. So people can also consider setting aside emergency funds to cover living expenses for at least 3 months. Some resources that may help with lupus-related financial costs are Patient Access Network, PAN Foundation. It's an independent nonprofit that helps people with chronic, rare, and life-threatening diseases pay for their prescribed medication. Social Security, that offers 2 types of disability insurance, including Social Security disability and supplemental security income. So SSD and SSI. Eligibility depends on how long the medical condition is expected to prevent someone from working and how long they have worked. People can apply for these benefits online by phone or by scheduling an appointment with their Social Security office. The Department of Labor is another benefit. It connects people with disabilities to resources, including how to apply for disability benefits, find employment, and more. So, reading all of this, it might sound like an easy thing. It might sound like just go online and figure it out. But remember, people who are doing these things, who need these things, are more likely than not battling a life-threatening illness, battling chronic fatigue, battling being fire hosed with information about their failing body, and doing another thing sounds like something impossible. I have been in this lupus game for almost 20 years, and I still get off the phone with insurance people and doctors' offices and specialists in actual tears, because it is frustrating. It is frustrating to need things. Okay, feel terrible. Go to a doctor. They tell you, you must do this. You need this. And you go to the specialist or whatever, or to get a procedure, to schedule a procedure, and they tell you, oh, you need this. Well, you need to qualify here, 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 here. Pay that. Insurance doesn't cover this. You need that, but insurance doesn't cover that. It's very frustrating. There's a lot of things that are like, this is a life-saving thing that you need, and then insurance doesn't cover it. It costs $1 million. I'm not exaggerating as much as I do exaggerate numbers a lot just to joke. I once used to take a medication called Cellcept that I needed to take twice a day. There was a lot of time constraints. You can't eat this many hours before and this many hours after. It has to be during this time of the day and that time of the day, blah, blah, blah. It was $150 per pill without insurance. There was no, I still think to this day, there's no knockoff brand to it. I think Cellcept is Cellcept. So I had something go wrong with my insurance, something with the paperwork or something. They cut me off completely. I went to get my insurance one day after work. I worked next to my pharmacy. They did not. They just had to give me out of pocket. They're like, oh, okay, well, you can just get a few pills until your insurance, because I definitely couldn't afford the whole shebang. So well, just pay for 2 days worth. So $150. Somebody math me. $150 twice a day for 2 days. How much did I just pay them out of my pocket? Out of my waitressing, going to college pockets. Okay, thank you. And then stress brings on flares, and they want you to not get stressed. Hey, Jean, what's up, girl? Hey, Jonathan, hey, not afraid. Yes. So, if you don't understand that 2 days of one of my medications, that's not every medication I was taking at that time. One of my medications was $600 on a medication they told me if I stopped taking it abruptly, I could have a heart attack or a stroke. You will understand that having a chronic illness is expensive. And there is not any kind of, there's not if you're just talking about that part of your life, just surviving. That's not living. So let's say you get all your medications paid for, right? Then you are still fatigued, sick, weak. You still need to pay for your food. You still need to pay for someone to live. Because God forbid that it's you alone. Because paying for someone to live, imagine you can maybe stay with someone. That's not going to be something that's easy to do. Living with someone with chronic illness is not always easy. You don't understand because you're not feeling the pain. You don't, you're not sick all the time. It looks like they're just laying around. It looks like they're not doing anything. It is laboring to blink. Blinking hurts right now. And you want them to contribute to the household. So you want them to do the dishes, the laundry, clean something, I don't know. It is not easy to be the person living there feeling that kind of shame of like, you can't contribute the way that you would if you were well. It's not easy being the person who is providing the shelter for them. Because I'm sure they feel bad. They also need help. Like, they don't want to be mean to you because they know you're sick or whatever it is. It's just, they need help too. Everyone needs to be able to pitch in. Survival of the fittest is legit, especially right now with the way the economy is. Like, you need to be bringing in money. So, all that to say, don't get sick. Don't have chronic illness. I'm not sure that I have a moral, really. Let me see if there's more facts I wanted to tell you. So more statistics I had. These are from 2016, so we're not great. But, so in 2016, a study published in the Nature Reviews of Rheumatology found that the average annual direct healthcare for cost of person with lupus is $33,223. Okay, so that was in 2016. And what did I just say about it? This was from, I guess this is this year. So 50,000. It went from 2017 to now. It's gone from 33, almost 34,000 to 50,000. Just regular medical expenses, okay? Infusions, medication, all that stuff. Wild. The study also determined that the average annual productivity cost, so productivity cost is lost hours of economic productivity due to lupus, was between $2,000 to $20,000. This was in 2017. So imagine now. The average annual cost for people with lupus, combining direct and indirect costs, all the prescriptions that were mandatory, turns out I am happier and in less pain without all the pain and muscle relaxer meds. There you go. That's right, Jonathan. That is right. Sometimes they just load you up with medication because they don't know what else to do, or like they just, they don't know your specific body. I'm very proud of you. That is hard to get off of prescription pain medication. Those are meant to be addictive because your body doesn't remember, like, your pain tolerance is there so that your body can make sure you don't, like, pass out or go unconscious from pain. So the more pain medication that you take, the less your body remembers how to produce those natural pain blockers, right? So the more you're addicted to them. Like, they're addictive because, like, chemistry in your body does that, because it's no longer going to produce that because you're taking it in, so you don't need to do that anymore. You don't need it. So the fact that you can get off of pain medicine is a painful experience in all the ways, mentally, emotionally, and physically. And I'm very proud of you. That's insane. And you are a very happy person now. And I love that for you. So the Lupus Foundation of America found that 55% of lupus patients reported a complete or partial loss of their income because they are no longer able to work full-time due to complications of lupus. 1 in 3 have been temporarily disabled by the disease, and 1 in 4 currently receive disability payments. This same survey found that 1 in 4 patients receive their health care through a government-sponsored program such as Medicare and Medicaid. I have been on all of those things. I get emails for, like, old people dating sites because I've been since 20, like I was 25, 24, something like that, years old, and I was on Medicaid, Medicare, and like another, whatever, kind of insurance, supplemental insurance. Yeah. And I was getting treatments that usually an old person would get in my 20s. So, and I was on disability off and on for a long time. Cried when I got on disability, cried when I got off of disability. Because I cried when I got on because I was ashamed in my 20s. And why is it that somebody's going to have to take care of me? I don't want to be dependent on anyone, much less the government. And then when you're on the government insurance, there's judgment, number one. There's, like, shame and guilt. Like, it's benefits I worked for, I guess. Like, I started having a job, paying into Social Security and that kind of thing since I was 14. So, like, technically, I had been working and putting into the system to get money back. Still, felt terrible. Felt ashamed. Felt discouraged. And then, I'm on that. There are all kinds of, there's all kinds of things you're not allowed to do when you are getting any kind of assistance like that. Yes, the healthcare system in the U.S. is a scam. 100% sure you are correct. Yeah, so there's all kinds of things you aren't allowed to do. If you make $1 over, or like if they find out you're making money that you're not supposed to be making, they will take it away from you, but then you have nothing to cope with the rest of the stuff. So like, they keep you in this weird limbo in between. You can't make too much. You have to be absolutely destitute in order for them to cover anything, and then you are guilted, and you are shamed, and you are put in the worst conditions because you can't go to a good hospital, even though the good hospital has the procedure you need and the doctors you need and whatever it is. Like, you have to go to the worst hospital because that's all you can afford, because you're not able to afford anything unless they give it to you. And it's a vicious cycle, and I want you to know that the mental stress of being a sick person is huge. So, now I know what I want to say. If you are the sick person, I'm here with you, I'm standing with you, I'm praying for you, I understand. We will get through. We always get through. Look for your resources. Ask the able-bodied people around you to help you. Ask for help. Ask for help for them to look for the resources that you can get aid in any kind of way. Free, half paid for, students that do things, like, all of those things are valid and you can look for it, okay? You better say now that is so true, they will keep you in bondage, 100%. Which is wrong. It is wrong. Like, yes, there are going to be people that abuse the system in every system. However, there are people that really do need help, and if you know someone who needs help, be that help. If you are a person who needs help, ask somebody for help. Yes, I'll put some links in the videos, giving you grace and time to do that. I will put some links so that people will be able to look for things, aid, and that kind of stuff. And being sick is expensive. So if you don't want to buy that green juice and those fruits and vegetables, okay, you want to buy a $150 pill twice a day? No? Okay. So take care of yourself, okay? Take care of yourself. I'm going to go. It's been long. I ran to you a bit. Thank you for grace. It's worth the rent. People out here suffering. I've been there. I've been there off and on for almost 20 years. So, yeah. Take care of yourself. And now you know. If you don't know, now you know. Loopies. I will talk to y'all tomorrow. Have a great day. Bye.